We're looking at how we can support children going through really challenging procedures, specifically when intense stress brings on things like nausea, which you see a lot during treatments like chemotherapy. So our mission today is to explore some of the supportive, non-invasive ways to find comfort that we found in the sources.
Yeah, and this is so important because, the sources point out that sometimes the standard medications, they just struggle, especially when the nausea is all tangled up with high levels of emotional and physical stress.
Right.
The body and brain are trying to handle both at once.
Yeah.
So we need tools that work on that, the internal communication system.
Yeah.
And our sources point pretty strongly towards sensory input, specifically aromas.
That interaction sounds fascinating. I mean, we all know the gut and brain talk to each other, but how do smells actually tap into that system? How do they promote calm and, ease that discomfort? Okay, let's unpack that.
So it really all comes down to the vagus nerve. You can think of it as like the main superhighway connecting your gut and your brain. It's carrying signals back and forth constantly about, digestion, distress, whether you feel safe.
And when stress is high, I'm guessing that traffic gets pretty intense.
Exactly. The vagus nerve starts sending all these distress signals straight to the gut. And that really contributes to that powerful, just overwhelming feeling of nausea.
Okay, so here's where it gets really interesting scientifically. If the vagus nerve is the messenger for all that stress,
Yeah.
then inhaling certain aromas is like what the sources call a gentle nudge.
That's a great way to put it. Instead of sending panic signals, the aromatic input encourages a state of calm. It's like it cools off that high-intensity conversation between the brain and the gut, helps turn the nausea dial down.
And this is happening on a chemical level, right? It's not just a feeling.
Oh, absolutely. It's rooted directly in neurochemistry. These aromas can subtly tweak the chemical balance in the brain.
How so?
Well, for Ren, they can help lower cortisol,
The main stress hormone.
the main stress hormone, and at the same time, they can boost something called GABA.
GABA, okay.
To put it simply, GABA is like the brain's natural brake pedal. It's a sedative. So by activating GABA, the whole central nervous system just relaxes a bit, which helps interrupt that stress-nausea feedback loop.
I see. And sometimes they can even give a little mood boost.
Yeah, sometimes you get a mild spike in things like dopamine, which can help with focus, or just lifting the mood slightly. It's all about restoring a balance that stress messes with.
That's a really powerful mechanism. So, okay, let's pivot to the what.
Hmm.
What are the specific aromas that the sources highlight for interrupting this loop, especially in clinical settings? What really stands out?
The leader for this specific context is absolutely peppermint.
Peppermint.
Yeah, the data from trials with kids getting chemo is pretty compelling. Using peppermint aroma consistently and significantly reduced the scores for both vomiting and retching.
Wow, so that's not just anecdotal, it's measurable physical relief.
It is. And it seems to work by directly soothing that vagus nerve activity.
Okay, so what about the aromas that focus more on the anxiety part of it? The feeling that often comes before the physical symptoms.
For that, lavender is a top player. It's excellent for anxiety relief. It's great at boosting those GABA effects we talked about and lowering cortisol. So it gets at the emotional tension that fuels the whole cycle.
And what about frankincense? I saw that mentioned.
Frankincense is another big one for anxiety. It promotes calm, lifts the mood. It seems to work by supporting anti-inflammatory pathways that can settle both the gut and the nervous system. And myrrh works in a similar way. It's a very grounding aroma that helps calm that inflammation-linked stress.
So what does this all mean for you listening? These are really powerful examples of how simple, accessible sensory input can offer real, tangible support and a sense of calm during what can be incredibly difficult and overwhelming times.
Exactly. The final takeaway here is just, it's empowering. Understanding these deep neurobiological connections gives you knowledge about supportive, non-invasive paths to comfort when it is needed most.
Thank you so much for visiting. We are so grateful for you. This has been educational content only. Please always, always talk to your doctor regarding any changes to your treatment.
Have a great day.
You are strong and you can overcome anything. And consider this. How might the subtle sensory inputs in your environment, the sense around you right now, be quietly influencing your own feeling of focus and calm every day? And how could you maybe start to harness that power for yourself?